are about 70% of successful rate for people who undergo spinal surgery. And many of them, even after the spinal surgery, they have to rely on some kind of pain medicines or spinal injection to manage their residual pain. That suffer from this kind of problems, we have good news for you. It is called the Acuphysio. It's a treatment technique that combines both the acupuncture and also the physical therapy together. And by doing so, we can restore your functional level as much as to the previous one. Not only that, a lot of people who have completed this kind of treatment, and they are very successfully to manage their pain to more than 90% or above. And here is the example I want to show you.
As you can see, this patient had a very beautiful scar after the spinal surgery, and it was done 3 years ago with the fusion at the 4 levels. However, after the surgery, the patient's quality of life is significantly hampered, and she cannot walk by herself without any assistive device. She can only walk about 2-3 blocks and has to stop. And her personal life is also significantly affected, and she lives on pain medication on a daily basis. As you can see, there are 4 levels of lumbar spine are being fused. This will significantly. We start with the acupuncture first. We put those points around the acupuncture point to improve the energy flow, improve the circulation, and also release the endorphin from the body. And we also want to deactivate the multiple trigger point. After the acupuncture, we're going to start doing the cupping. The purpose of the cupping is to improve the localized circulation, break down the adhesion, deactivate the trigger point, and also mobilize the soft tissue. After the cupping is finished, and there's a circle mark will be left on the patient's back. This is normal, and this is what we want, because we want to improve the circulation, and the skin will respond like a erythema, which is the wet mark. Usually that will last about 2 to 3 days. After we finish the cupping, and we go ahead with this Guasha. This is a very old traditional Chinese manual therapy, and the purpose of this technique is to improve the localized circulation, break down the adhesion, and also deactivate the trigger point. Another way we can do is combine both the cupping and the Guasha technique. After the acupuncture, we're going to start doing the cupping. The purpose of the cupping is to improve the localized circulation, break down the adhesion, deactivate the trigger point, and also mobilize the soft tissue. Too strong, and the cup can come off. Okay. The last step we're going to do is called the intramuscular stimulation. And what we are trying to do is that we're trying to give a multiple in and out of the needle thrusting onto the scar tissue, and hoping that the scar can be break down and also induce more circulation and to desensitize the scar tissue. Okay. As you can see, the scar is pretty extensive from the proximal to the top, which is about L1 and L2 all the way to the sacrum area. So what we're trying to do is that we're going to put the needle into the paraspinal muscle, and at one time we are not able to finish them all, but we're going to select the middle part, because this is the place where the most hardness of the soft tissue is, so we're going to focus on that. And then okay, as you can see, the spinous process is along the line in here, and to make sure, we're going to locate the spinous process. Okay, and then here the spinous process we're going to put on the side. Okay, and then go all the way in. As you can see, my needle could not even go in because of the well organized of the scar tissue. We're going to try our best. Sometimes we can even go in at one time. It is totally okay, but at least we're going to do it multiple times and hoping that the scar tissue can be break down. And that's what we're going to do. You can see from the needle itself is bending, and this is also an indication that the scar tissue is significantly well organized and the needle cannot even go in. And we're going to do it multiple times in the future, and hopefully that kind of a condition will be improved.
See if you can walk without a cane.